The strangest thing, to me it was the strangest thing, I had to double down, and I'll admit this to you. Probably shouldn't admit this to you, because I am the hardest working man in no business, and it means I know. But there was something that had me temporarily stumped today. And it's the news. It's been out there for a while, just nobody picked up on it. The news that the regime has delayed the caps on out-of-pocket expenses in Obamacare. And it confused me, because that means that those are consumer cost protections. So the cap, the whole language confuses me. Caps on out-of-pocket expenses. I had to start, what is an out-of-pocket expense on health? Because to me, it's all out-of-pocket. I pay for all of it. So what? No, I don't use my health insurance. I just don't. I don't even know if I have any. But if I do, I don't use it. So it's all out-of-pocket to me. So well, I know. I mean, I'm going to be joining the hoi polloi now. I mean, I'm just may as well go to, become a congressional staffer and maintain my current health care status. Anyway, it's all out of pocket to me. So I was thinking, what does this mean, out of pocket expenses? Who's capping what? What's being capped, and why is this such a big deal? I mean, I had to do a crash education course for myself today. And what I have figured out, and here's the real reason I was confused, it's because this has been delayed till 2015, and these are consumer cost protections that have been blown out. These are the insurance companies being protected. The evil insurance companies are the ones that get this benefit. And I'm thinking, why do this prior to the 2014 midterms? Why not do something that keeps costs down for voters? This is going to cause everybody's insurance costs in every way you can imagine to skyrocket, because the insurance company can now make you pay anything they want out of pocket. There aren't any caps on it. These consumer cost protection. And by the way, when the Obamacare is called the Affordable Care Act, this was the affordable part. The consumer cost protections, the caps on out-of-pocket expenses, the caps on what you were going to have to pay, that was the affordable, or is the affordable in the Affordable Care Act. So what Obama has done, and as the New York Times tells us, by the way, this has been up on a government website for months, but it was mixed in with a bunch of legalese and mumbo jumbo, and nobody caught it. They didn't trumpet it. But what the insurance companies here are getting a break, not the consumer. And that's what had me confused about this. Because the employer mandate has been delayed. And that, of course, the employer mandate requiring the employer to provide you insurance, that's been delayed. Now the out-of-pocket caps, which are the consumer cost protections, they've been delayed. And remember, before all of this, whenever you went into an exchange, you had to prove somehow that you qualified for a subsidy. You don't. You can go into an exchange, because that's been delayed too. But none of this is being implemented on time because it's unworkable. It's undoable. It's simply just a mess. It just can't be done. And here's the way the New York Times writes this. In another setback for Obama's health care initiative, the regime has delayed until 2015 a significant consumer protection in the law that limits how much people may have to spend on their own health care. The limit on out-of-pocket costs, including deductibles and copayments, was not supposed to exceed $6,350 for an individual and $12,000 for a family. But under a little noticed ruling, federal officials have granted a 1-year grace period to some insurance companies, allowing them to set higher limits or no limit at all on some costs in 2014. So what this means is that the ultimate promise of Obamacare to keep your costs down by limiting what the insurance company could demand you pay as your share of whatever treatment you get has been delayed. Now the insurance company is not forced to set a limit on what you pay and they cover the rest. The insurance company can now charge you whatever. They can raise your deductible. They can lower your deductible. They can get rid of your deductible. Now, a further investigation, and I have to admit, I probably shouldn't do this because I'm in the no business, and this was all foreign language to me. What this ultimately means is that when 2015 arrives, after this delay, everybody's costs are going to go through the roof. Consumer, insurance company, that's what Obama is deferring. That's the regime is what they're trying to do is to defer because they've told everybody that their premiums are coming down $2,500. They've told everybody that Obamacare is going to lower the deficit and reduce the national debt. And what Obama has done is delay. See, so convoluted. The truth of the matter is that everybody's costs are going to skyrocket. That's the design of the plan so that you can't afford private sector insurance and have to go to government. Single payer is what they want. And the way they're going to get you there is making it impossible to afford via insurance. That's the objective. It's always been the objective, to make it impossible for the average family to afford it. To blame the private sector insurance companies for all the expenses, for all the costs, to set Obama and the government up as the saviors when that happens. Well, that was supposed to start happening this year. And if the midterms were not so crucial and not so desirable and not so important to Obama, they would have allowed this to implement. But instead, the upshot of all of this is that the massive cost increases, the massive price increases on everybody are being delayed here until 2015, until after the midterms. So this is just the next delay or waiver on implementation of Obamacare. The employer mandate, the thing that required your employer to provide insurance, that's gone. That's delayed till 2015. So your employer doesn't, this Obama wants your employer to stay in business one more year. Because the employer mandate's going to put a lot of them out of business, especially when the fines catch up with the cost of a policy. And then the other big thing, and there have been thousands of waivers for individual companies, as you know, but the other big thing that's happened is that the requirement that you prove that you qualify for a subsidy at an exchange, that's been broomed entirely. Now, all you have to do is walk into an exchange and tell whoever's there or online when you log on and do it there that you qualify, and you do. It's the honor system. The only people who are not affected by any of this are government staffers. They are the only people unaffected, as you know. Congressional staffers are going to get their health care costs paid for to the tune of 75%. Obama negotiated that personally for them after they whined and moaned and complained. Remember, they earn anywhere from $70,000 to $175,000 a year, and they said, we can't afford what this is going to cost. And, that wouldn't look good. Members of Obama's government can't even afford it, so they've made it affordable for them by subsidizing them maximum $11,000, $12,000 a year. Now, how about these amounts here? The limit on out-of-pocket costs, this is what you pay. This insurance is going to cover X, then the out-of-pocket, that's what you pay. The limit, this has all been broomed now until 2015, but the limit on out-of-pocket costs, including deductibles and co-payments, was not supposed to exceed $6,350. So you, or anybody, American consumer, was going to be responsible for at least $6,000 of your health care costs, maximum. That was going to be capped, and then whatever treatment you're required above that, the insurance was going to pay. That's now been broomed. There is no cap, and if your treatment costs $12,000 and the insurance company doesn't want to pay it, you're stuck. And I'm still surprised that they're doing this, sticking it to the consumer prior to 2014. There are far more consumers than there are insurance companies. But what they're really delaying here is massive costs increases for everybody that would implement with, because see, if you have, it's like water. If you cap out-of-pocket expenses, you tell, Mr. and Mrs. Enos Slobodnik out there in Ottawatomie, Louisiana. You tell them that no matter what happens to them, the most they're going to have to pay is $6,000. Well, Mr. and Mrs. Enos Slobodnik are very happy. But if Mr. and Mrs. Enos Slobodnik incur expenses of $12,000 to $15,000, somebody's got to pay it. And guess who? Those of you who pay and buy insurance. Premiums would go up to cover this. That's what is scheduled to happen. When you put caps, when you tell some people that their costs are not going to exceed X, when their costs do exceed X, somebody has to pay for it, and it's going to be covered by rising premiums for everybody. That's what Obama is limiting, the rising of premiums, the increase in premiums to cover people who go above and beyond their caps. Have I made this somewhat understandable? I hope. The bottom line is, see, the point is nothing is free, and we have a lot of people who think it is. Nothing is free, and the caps were one of these artificial elements to make it appear as though it were affordable or not really free. But I still think, for some people paying $6,000 a year in health care costs, it's going to break their bank. And I mean, that is a lot of money for health care. And that was what the cap was. You wouldn't have to pay any more than that. But now there's no cap. They can charge you whatever, folks. But the fact that there isn't a cap theoretically means that premiums won't go up on others. So while costs are going to go up for some, they're not going to go up for everybody in the form of higher premiums. But next year, the next 2015, they will, because the caps go into place. $12,000 for a family, $6,000 individual. When the caps hit, that means some people are going to have their health care, not insurance, health care costs paid for. Somebody has to pay for that. And that'll be covered with increased premiums. Those premiums going up is what are what have been delayed. And everybody has to have insurance. Everybody. Or pay a fine. So what Obama has done is delay these and rapidly rising premiums, which we're going to face as a result of these caps whenever this happens. This is the affordable part of Obamacare, the caps. The affordable for you, the affordable, and these consumer cost protections have now been delayed. You are on your own. Okay, now we have some confusion here on the caps and what they are. Now, the New York Times story mentions $6,000 for a single person, $12,000 for a family. However, there's a story from Forbes today that quotes from the actual law, and it basically says Section 2707B, the Public Health Service Act, as added by Obamacare, requires that a group health plan and a health insurance issuer offering group or individual health insurance coverage may not establish lifetime limits on the dollar value of benefits for any of the participant or beneficiary. Annual limits on cost sharing are specified by Section 1302. Starting in 2014, deductibles are limited to $2,000 per year for individual plans, $4,000 per year for family plans. There's all kinds of mandates and regulations that are going to make it more costly. So what was going to happen, according to Forbes, starting next year, the caps would be $2,000 for a single person, $4,000. I mean, that's all they would have to spend. Everything above that would be covered by somebody else. Who? Well, everybody else that pays or buys insurance. Premiums would have to go up to make this possible. And the qualification for these caps is quite large, by the way. So a vast majority of the American people would see caps not of $6,000 and $12,000, but of $2,000 and $4,000, at least on their deductible. But that's not going to happen. That's been delayed. Essentially, there are no caps now for all of next year. So that 6,000 figure, the 12,000 figure that's in the New York Times, had the law been implemented, the numbers would have become 2,000 and 4,000, not 6 and 12. Well, it doesn't mean that the expenses are going away. It just means that certain people are not going to be paying them. And the way this was going to be handled was through the miracle of premium increases on everybody who didn't qualify for these caps. That's what has been delayed. If you are going to endeavor to read about this yourself, there are two stories out there today, and I would heartily recommend that you focus on the Forbes story, because I really think the New York Times story is purposely confusing and not complete. I don't think the full picture is presented in the New York Times story. Let me summarize for you. I don't know about you, but some of this language, I have to really apply myself. The whole notion of out-of-pocket caps on out-of-pocket expenses, I had to go to school on that. And I've gone to school on it. I know what it is now. And here's the bottom line. Because the Forbes piece adds a lot of important data that the New York Times avoids. And the most important takeaway on this news today is that once the insurance companies are no longer allowed to collect these out-of-pocket fees and deductions, they're going to have to charge far more for the premiums. And that's going to make everybody's rate skyrocket. Everybody. So there is a huge advantage to the regime in putting that off until after the midterms. Here are the numbers. The New York Times says that right now the cap on a single person is $6,000. I'm rounding off here, and $12,000 on a family. Those are the out-of-pocket expenses, the combination of what you spend at the pharmacy that isn't covered, your deductible, and all of that. Now, Obamacare, according to Forbes, and they cite the law where it's not their assertion, they actually quote from the law. The actual limits on cost sharing specified by the law are $2,000 per year for individual plans and $4,000 per year for families. So for whoever qualifies for this, the most out of pocket they can pay is either $2,000 or $4,000. Well, their expenses, their actual expenses, are going to greatly exceed that. So who's going to pay for it? Everybody, including them. Everybody's premiums are going to, as long as there are insurance companies. And I think this is a fundamentally important point to make as well. Because right now, that's where everybody is getting their insurance. The government is simply, even at the exchanges, the government is selling insurance or offering it from private sector companies. But fewer and fewer of them are participating because it doesn't make any economic sense. So if the trend continues, it isn't going to be long before private sector insurance companies don't exist, which is the plan. It's not next week. It's not next year. It's years out, but that's the plan. So what Obama has done, telling everybody, yeah, their costs are going to go down, your premiums are going to go down. At first, there are going to be, for certain people, the maximum amount they will be forced to spend on whatever their health care costs are is either $2,000 or $4,000, depending on their single or family. But if, let's just take the case of a single person, Enos Slobodnik. Enos has a debilitating disease, and it costs him $12,000 a year to be treated. The most Enos is going to have to pay is $2,000 of it. Somebody's going to have to pay the $10,000 that he doesn't. And there's going to be everybody else via rising premiums. The insurance companies are not going to sit there and simply absorb this. Nobody would. They're going to go get the money that they have to spend somewhere, and they're going to get it from paying customers. Premiums are going to skyrocket. Now, at some point, the premiums are going to get to the point nobody can afford it, at which point Obama or whoever, the Democrats are going to ride in on their white horse and say, these people are ripping you off. This is not what Obamacare intended. We tried to rein them in, but they found ways around it to screw you and rip you off. So we're going to come in and save the day. And we're going to offer you cheaper alternatives here at our single payer window. That's the ultimate plan here. The thing that is confusing is that there really are two caps. The annual, which is a cap on the deductible, which the consumer obviously wants to be as low as possible. And then there's a lifetime cap on total payouts, and the consumer wants that to be as high as possible. And the lifetime cap is going to be, I think, $1 million, $1 million, $1.5 million. Once you have reached that, you're done. It's sort of like gift taxes in the IRS. You have, and it may be incrementally higher now, I have to check, but over your lifetime, you can give a total of $1 million tax-free. Once you do that, once you exceed that, the tax on every dollar you give is like 43 or 44%, and you pay it. Now, the giver. Now, right now, you can give anybody $13,000 a year tax-free. But every time you do, that's subtracted from your lifetime allowance of $1 million. So if most people never going to affect them. The idea that people are going to give away $1 million is never going to happen to the vast majority of people. But I simply use it as an example because there's a lifetime limit on how much you can give tax-free. And it's the same thing. There's a lifetime cap on insurance that you don't have to pay. And I think it's $1 million, $1.5 million. It's coming down. So there are two kinds of caps. We're talking about the lifetime cap and we're talking about the annual. And it's the annual cap that I've been talking about here in the examples that I have been offering today. But the bottom line is this. The caps were supposed to come way down starting in January. The amount of money individuals would have to pay on their own was going to come way down. That would cause premiums everywhere to skyrocket, noticeably so. Everybody would notice it and get mad. That is what has been deferred until 2015. It looks like the insurance companies are being given a break here. At first glance, when you first look at this and you say, well, what? Because the caps are not going down, individuals are still going to be subjected to the current caps. And you would think going into the midterms that Obama, the regime, would take steps to make it easier on the consumer because there are a whole bunch of them and they're voters. And in truth, he is. It's just that in giving the insurance companies a break here, What he's actually doing is putting off for 1 year what can only happen, and that is dramatically increasing health insurance premiums. Because once the new caps go in, much lower, somebody's got to make up the expense. That's what's been delayed for 1 year. So the practical result of this is that the huge expenses, new expenses that everybody is going to feel with Obamacare, I mean, above and beyond what have already been felt, have been delayed until after the 2014 midterms, so as not to harm the president's party. It's purely a cynical political ploy. Kathleen Sebelius, Health and Human Services Director, is out there saying that this is not a bait and switch, but it is. It is entirely bait and switch. Minor correction. Sorry, I got one thing wrong I need to straighten out. Obamacare does away with the lifetime cap. The current lifetime cap is $1.5 million. Obamacare does away with it, meaning there is no limit on how much the insurance company must help pay for your coverage, your treatment. Right now, there's $1.5 million cap lifetime that removes. Now, it may sound good to you as a consumer, but you're going to pay for it on the other end on higher premiums. Money is money. Costs are costs. They're not going down. Everything associated with health care is going up. Everybody's going to have to pay it. Obamacare is an attempted illusion to make a lot of people think they're getting a big break. And we've had callers here. You've got people in your office the day after this thing was signed into law thinking it was free. You got all kinds of people out there thinking this isn't going to cost them anything or much. And it's going to cost everybody a kitten caboodle, but not starting until 2015. That's the basic sum of this. Here's, again, Section 2707B of the Public Health Service Act, as added by Obamacare, requires a group health plan and a health insurance issuer offering group or individual health insurance coverage may not establish lifetime limits on the dollar value of benefits for any participant or beneficiary. So there'll be no limits on how much insurance companies have to pay out. No limits. Can't stay in business that way. Do you know how insurance companies make their money? No. Do you know how they do it? You know what they really do? Yeah, they're betting on actuarial. What do they do with your premiums? That's right. They invested in other things. All they are giant. They're bookies. In a way, I mean, they're legalized, but they're making a bet with you. You want to ensure the fact your house isn't going to burn down. You're going to make a bet. They're going to make a bet that it will. You make a bet that it won't. Here's the negotiated price. Life insurance, same way. You pay the premium. Everything's adjusted in their favor. Obviously, they hold the cards. And then they take all these premiums and they run out and make investments in it. This is what got AIG in trouble. Hank Greenberg, the guy that ran that, came up with some of the most creative ways for AIG. They sold insurance, but what they were actually doing with the premiums collected, it was all legal, but it really ticked off Elliot Spitzer because it was too creative. So he became a target. Greenberg did. But they take all this premium money and they invest it and they try to grow it all kinds of ways, and they don't like to pay out. Quite honestly, they do in certain circumstances for PR purposes. You have a natural disaster, a tornado, they're really right in there paying off. But they're just making bets with it. What's happening here is they're now being told, because of this law, that there is no limit on what they are going to have to pay. They can't stay in business. Nobody could, which is the ultimate aim of this.